Welcome to today's lecture. Uh, Today we'll be looking at epidemiological study designs. This is the second lecture in this series. My name is John Wadamuma from the School of Veterinary Medicine at Hunza. So there are two main objectives in this study. We want to understand the basic concepts of different study designs, and also to learn about the advantages and disadvantages of several study designs. So you should be able to understand the different concepts of study design, and also learn about the advantages and disadvantages of such designs. So what are the expected learning outcomes? You should be, at the end of this lecture, you should be able to recognize the concepts of different study designs, and also be able to appropriately use a study design in a research. So you should be able to use the knowledge you gain in this lecture to be able to choose what study design is appropriate, to allow you answer a particular research question. And also you should be able to describe the basic concepts, that undergovern the different types of study designs. So when you look at epidemiology is described as the study of disease frequency and their determinants in a population, or rather we could say is the study of the health events and also their determinants in a population, and also how they can be controlled. And so broadly speaking, we have two major categories. We have descriptive epidemiology and analytical epidemiology. So descriptive epidemiology seeks to measure the frequency in which disease occur or collect descriptive data on possible causal factors. So a descriptive a study will measure disease frequency or will collect data on possible risk factors, while analytical epidemiology attempts to specify in more detail the causes of a particular disease. So depending upon your hypothesis, you may either want to use descriptive epidemiology, or you may want to use analytical epidemiology. You may want to use a study design that will be appropriate for each of these cases. You find that one particular study design is stronger in responding to the needs of descriptive epidemiology, whereas others are more stronger in responding to the needs of analytical epidemiology. And when you talk about observational studies, basically they are based on these two factors, or in other words, if you want to choose a particular study, observational study, normally these two factors will guide you. One of the factors that will guide you is the type of sampling from a population. Is it going to be based on exposure, or is it going to be based on disease? So the type of sampling may be based on whether the animal has been exposed, or whether the person has been exposed, or it will depend on whether the person is diseased or not diseased, or on either of these, or neither of these. And also it may depend on the temporal sequence of observation, how you are going to observe these events with respect to time. So this is what we call the temporal sequence of observation. Are you going to do it at one point in time only, or are you going to look forward, or are you going to look backward as you collect your data? So these factors will help you to choose an appropriate study design. So when we look at the two broad categories of study designs, which are experimental study designs and observational study designs. So in an experimental study design, you remember what we said, that they are characterized by the following. The investigator will identify the study units, and then he will put those study units in a common context. In all cases, when you're doing an experimental study, you need controls. So you have a control group and the intervention group. So you put them in common context so that they are the same. And then you do what? You make an intervention. After you make an intervention, you do an observation. You observe, and then after you observe, then you record the information that you've recorded from your observation. And so, under the experimental study design, you see that the major factor here is that the investigator does the manipulation. He allocates a treatment to groups. He say, for instance, if you're doing a curative study where you are seeing whether we want to see whether the efficacy of a particular product, the administrator or the investigator will administer this particular product to the study subject. And so there are two types. We have a pure experimental study design. Also, we have got the quasi-experimental study designs. And then we have also laboratory, those studies that are based in the laboratory, well as others are, in the real world. They are field-based experimental study design. And also, when you look at observational studies, in an observational study, the characteristic of an observational study is that the investigator identifies the subject that they want to investigate. When they identify those subjects, they observe the variable of interest. They make an observation. Then they do what? They record what they observed. So there's no manipulation of the study factor by the investigator. All they do is observe and then what? And then record what they have found. So there are two also categories in this. We have descriptive observational study versus analytical observational study. And then we can have also retrospective and also prospective. So these are the two angles from which we can look at in terms of observational study. Now, when you're choosing an a study design, it is important that certain things are taken care of. You want to be specific. Choose an hypothesis or formulate an hypothesis which is specific and testable. So you don't want to be, like throwing a bullet in a bush and then hoping that something will be hit. It's not a fishing expedition where you just throw your hook in the water and then you hope that you catch something. You have to be specific. It has to be targeted. So you have to have a specific and testable hypothesis. There are certain hypotheses that cannot be testable. So you need to make sure that you are firm on this. And also you need to satisfy yourself regarding the aspect of internal validity and external validity. What is it? What is it that you want in terms of internal validity, and what is it that you want regarding the external validity? We explained this. In fact, I explained this in the previous lecture where we looked at internal validity as the ability of a test to relate the cause to the effect. And this is and then external validity has to do with your ability to extrapolate your findings beyond the study setup. So, are you able to extrapolate your findings, to the real world or to the study population outside your study group? So, studies which have establish a strong relationship between a cause and an effect, those studies have high internal validity. Whereas the studies whose result can be extrapolated to the real world beyond the study setup, those have got high external validity. So you need to choose which studies, what is it that you want to achieve in answering your research question or finding a solution to your problem. So there are different types of study designs, and one of them is the case series or the clinical series. So a case series is a type of medical research study that tracks subjects within a known exposure, such as patients who have received a similar treatment, or examines their medical records for exposure and outcome. So it's done, on patients who are known to be exposed to a particular, risk factor, and of this, then the medical officer or the vet makes follow-up on this. So case series report new diseases or health-related problems. They may provide some descriptive data on exposure or potential causal factor. So, clients are coming or people are coming, and then you study them with respect to certain exposure, and then you follow up what the outcome is. For instance, some may be given treatment as they come to the practice, and then they will follow up what the outcome is on those. So it is most useful for describing the potential effect of new intervention. So it can be used in this case. We're saying that if there's an intervention, as people come and maybe there's a new drug on the market, and the clients are given this drug, you may want to you may use the case series to establish the potential effect of such an intervention. But it can also be used to describe the effectiveness of an intervention or unusual diagnosis. So you may also use it based on how people have responded to a particular drug or particular intervention. You may want to use it to evaluate how effective a particular intervention has been. Also, it's used in describing unusual responses to intervention, and these responses could be good or bad. So when people come, for instance, and then there is a product that has been administered or under investigation, so you give them, and then you see how people respond, and you can use that to see whether the responses are good or bad. So some of the advantages of the case series is that they've got high external validity. You are dealing with people in a real world. It's not that it's stage managed, you have not sampled. They are coming to the practice, and then you are observing as things are happening. So the study results are closer to those obtained in routine clinical practice. It would be also useful when a randomized controlled trial is not appropriate or possible. So when it's not possible to use a randomized controlled trial, then the case series may be the alternative study design. And there's no interference in the treatment decision process. So you don't interfere. You are not kind of like choosing who gets what. This is part of the routine, and then you observe what is happening. So you receive a wide range of patients, so that is also an advantage. And also the study takes little time. So it's not a protracted study, it normally takes a little time. And it's useful for hypothesis generation, but not conclusion about etiology. This cannot be established under a case series. Informative for very rare disease with a few established risk factors. So these case series are very, very informative when you're dealing with cases that are very rare, and the risk factors are not known. There are some more advantages in the reference that I've provided at the end of this lecture. So if you are interested, you can refer to the reference at the end of this lecture, and there you find more things listed concerning a case series or clinical series study. About the disadvantages, lack of control can be a problem in this case, because people will say, what were you comparing this to? Because people are coming, and probably you are just dealing with cases, so you have more positive and probably no negatives, so you don't have the controls. And often data collected may be incomplete. Some people may come, and maybe it may be difficult to follow them up. And also lack of a denominator factor. In this case, because you're not doing sampling, you may be just receiving cases. You are seeing cases, but you don't have the denominator factor, the number, the actual population, so that you can use that, to calculate rates. And it cannot study cause and effect relationship. So if you want to investigate the cause and effect relationship, it's very difficult to do that under this the case series. And it cannot assess disease frequency, and also lacks external validity because cases may not be representative. So normally when you are dealing with cases, the population you are receiving is a biased population. It's not randomly collected, so it may be difficult for you to extrapolate your finding to the general population. And an outcome may be a chance finding and not characteristic of a disease. So when you're doing a test series, you may find that a particular outcome may not be really as a result of the real characteristic of a disease, but just a case of chance. So the other type of study that you encounter is the cross-sectional study. And the cross-sectional study measures existing disease and current exposure levels. So they provide some indication of the relationship between the disease and the exposure or non-exposure. So we can use the case study to estimate frequency and also to establish, relationship between disease and the exposure factors or the risk factors, whether those that are exposed, whether there's an association between exposure and and disease or otherwise. So a cross-sectional study, in a cross-sectional study, you sample without knowledge of either whether the study subject is exposed or disease. You remember that one of the characteristics that defines a particular study design is how you do the sampling. How you do the sampling with respect to the exposure status of the animal or the exposure status of a person, whether they are exposed or not exposed, or also how you do the sampling with respect to their disease status, whether the disease is not diseased. So in a case control setup, when you are doing the sampling, you don't have knowledge of whether your study units are exposed or non-exposed, or whether your study units are diseased or non-diseased. So you sample this as you randomly sample your subject without knowledge of the exposure or disease status, and then you start finding out uh, whether they are diseased or non-diseased. So first you sample without knowledge of their status, and then when you have sampled, you've included them in your sample population, then you start finding out their status. So it is done, sample collection at one point in time. Remember also the other criteria we said is how samples are collected with respect to time, the temporal aspect of sample collection. We mentioned, if you remember, we said, is it one point in time or is it forward or backwards? But in a cross-sectional study, the sample is collected at one point in time. And it's mostly used in prevalence studies and also in surveys. What are the advantages of cross-sectional studies? They are good designs for hypothesis generation. So when you want to generate an hypothesis, a cross-sectional study will be ideal for such a situation. It can also be used to estimate overall and specific disease prevalence and sometimes rates. So you can use a cross-sectional study to estimate a prevalence of disease in a given population. But it can also be used to estimate exposure proportions in a population. So you can use this to estimate how many study elements are exposed in a population and how many are not exposed. They can also use to study multiple exposures or multiple outcomes or disease. So these are some of the advantages of the cross-sectional study. More advantages, relatively easy to conduct, and it's quick, and normally it's expensive. There are no issues of subjecting animals or human beings to particular treatment exposures. So the aspect, normally this type of study does not suffer much to ethical issues. And it's best suited for studying permanent factors such as breed, sex, or blood type. And often is often good first step for a new study issue. So we are saying that this is very good in generating hypothesis, and so they make a good step when you are doing a new study. And what are the disadvantages of an epidemiological study design? Sometimes this particular study design may be impractical for rare diseases. For diseases that are not very common, such as cancer, for instance, and others, which you may not be common, you find that this may not be an appropriate study design to use. And are not useful for studying causation. So the uh, cross-sectional study may not be very useful when you want to establish the relationship between an independent variable and a dependent variable. So it may not be used. And also is subject to bias. So because it's very difficult to control confounding in this, so you find that the study is prone to bias. And also the investigator has no control over the sample size for each exposure by disease subclass. So you have no control how the different subclasses in a population are exposed, are exposed. So the other disadvantage is that it has a problem with the temporal sequence of data. When you do a cross-sectional study, it may be difficult to know, especially when you want to establish causation, whether the factor of interest occurred first or exposure occurred first. So it may be difficult to sequence data. And it's also hard to decide when disease was actually acquired. If you want to know when exactly was disease or acquired, when the person actually got sick, it's very, very difficult to know under the cross-sectional study because you go in a population at one point in time and observe both exposure and outcome of interest without really knowing when exactly the particular study unit was exposed or when the disease was acquired. The disease may also cure exposure. So it is possible that you are looking for a particular risk factor and the animal or the person may have been exposed, and then the exposure, the disease itself may cure or may get rid of the obturate the exposure. And it's also possible under these circumstances to miss conditions that are under latent period. So when you go into a population and the infection is still in a latent stage, it hasn't clinical cases or the symptoms have not manifested or the immunity has not been mounted for you to be able to detect antibodies. So you find that if you do that, you may miss certain infections that are actually present in a population. And also this kind of information, the recall of previous exposure may be difficult because you may be wanting, for instance, to ask a question to humans, for instance, regarding their exposure history. And we are saying that recall of previous exposure may be difficult in this cross-sectional study. So the other type of study design is the case control study. A case control study identifies existing disease and look back in the previous years to identify previous exposure to causal factors. So what the case control study does is that you go into population, then you are looking for persons who are diseased. Let me give an example of smoking. If we say our interest is to look at smoking with respect to lung cancer, you want to test an hypothesis that there is no association between smoking and also suffering from lung cancer. That's your now hypothesis. So independent variable in that case is smoking, and the dependent variable is lung cancer. You want to test that. So what you do is that you go in a population and look for persons who have got lung cancer. You go, say, to the cancer hospital and look for people who already have lung cancer. And then you find out, with respect to their exposure status, whether they have been smoking in life. So this type of study is conducive for rare cases, cases which are rare conditions. For instance, the one that I've mentioned, such as lung cancer and many other conditions, which take long to manifest. So the cases in this case, we are talking about the study units with a disease of interest, and the controls are those without. So we are talking about case controls. So the cases, those with condition, the controls, those without. And then you can now estimate the frequency of disease among the frequency of exposure among the cases, and the frequency of exposure among the cases, non-exposed. Uh, Analysis are examined then with respect to the exposure status. Analysis are examined with whether the particular subject has been exposed or they have not been exposed. The advantages and disadvantages of case control studies. The case control studies are designed for rare diseases. So I say that for diseases which are very rare, this study is quite conducive. It can be accomplished also quickly since events of interest have already occurred. So they are quick to achieve because you are looking for cases, and these cases have already occurred. And also you can study several potential exposures at the same time. You can study several potential exposures. It could not be smoking, it could be other things. So you can investigate. You may say that, for instance, this cancer could be, for instance, as a result of maybe staying in a certain environment, or smoking, or any other possible exposure factor. So you can study multiple exposures at the same time. So it lends itself well to hospital-based study and outbreak. So this kind of study is quite appropriate when you are doing hospital-based studies and outbreaks. So these are some of the advantages of a case control study. The disadvantages is that it has a problem with the temporal sequencing of data. When did the disease develop? Did the disease develop before exposure or after exposure? It may be difficult to ascertain. Maybe cancer developed before a person started smoking. So those are some of the challenges that you may have. Also, hard to decide when disease was actually acquired. So if you want to have an idea of exactly the timing with respect to when the disease started, this particular study may be problematic, to give you such type of data. And disease may cure exposure. For instance, if exposure was there and then a person gets disease, you find that the evidence of exposure may be cured. For instance, let's say, if a person gets cancer and they used to smoke, and because of the condition, they stop smoking. So disease may cure exposure. And also, you are likely to miss disease in the latent phase. Remember, like what we said in the case of cross-sectional studies, those conditions which are in the latent phase, you are likely to miss them. And also, from this, you can't calculate incidence. You also can't calculate population risk, relative risk, and attributable risk, because you have got no denominator value to use in calculating these proportions. Because when we calculate risk is a proportion, and also attributable risk, also these are proportions. They require to have a denominator value, which is missing in case of a case control, and they are prone to bias. So there is high potential for bias. The other type of study design we look at is the cohort study. In a cohort study, subjects we start with exposure. So what we do is that we identify subjects with respect to their exposure status. So what we want to find out is whether a particular exposure pattern will lead to an hypothesized disease outcome. So we look to certain exposure factors. We say this animal is exposed and this animal is not exposed. Or this person is exposed, the other one is not exposed. So we group this animal with respect to their exposure status. Remember that in a case control study, we grouped the study groups with respect to their disease status, and then we looked for exposure. But in a cohort study, we study with exposure and then look for the outcome of the disease outcome in those two groups. So it's in a longitudinal study, subjects are followed over time with continuous or repeated monitoring of risk factor or health outcome. So what we are doing in this case, we are saying that we have these two groups whose exposure status is known, and then we follow them up with respect to the occurrence of the outcome of interest. Let me give you an example, for instance. You may want to say, to investigate whether there is an association between lameness in cattle and the type of floor surface in which the animals are raised. So your hypothesis is that there is no difference. The now hypothesis is that there is no difference in the exposure in the lameness in cattle, regardless of the floor surfaces where they are raised, whether they are raised on smooth or rough surface. So then you classify animals with respect to their exposure status. Some animals are raised on a smooth surface, others are raised on rough surface. And then over time, you monitor the occurrence of lameness. So you have predefined the exposure status, the type of floor surface, rough or smooth. And then you look for outcome, which is lameness in this case. So what are the advantages? Can get the base assessment of exposure and can deal with changes in the exposure. So this study gives us a better opportunity to see what is the likely outcome of that particular exposure. So it's very good. And also you can deal with changes in the exposure status because you are monitoring over time, so you can see if there are changes in the exposure patterns. And maybe the only design if exposure needs to be measured directly. So if you want to measure exposure directly, this particular study offers such an opportunity and also allows study of rare exposures. You remember that the other one is the case control study is good for studying rare cases or rare disease outcomes, but this one is ideal for studying rare exposures. It's the only way to get prospective information for laboratory factor data. So if you want to get prospective information, not retrospective, this is a good study design. If you want to get rapid information for factor diseases. Also good for establishing temporal sequence and natural history of disease. Because it is a prospective, you follow up the cases, so it offers you a good chance for you to establish the temporal outcome and natural history of disease, how the disease progresses over time, and can examine multiple outcomes linked to exposure, often find other effects other than those that hypothesized. For instance, in this case, what we are saying, the example I gave you, we want to see whether there is an association between the type of floor surface and lameness in cattle. So our outcome of interest, or our hypothesized outcome, is lameness. But in trying to investigate that, we may find that actually there are other conditions that may come as a result of these differences in the exposure status. So it gives you, you can examine multiple outcomes linked to exposure. It can also estimate overall and specific disease rates. So we can use the cohort study to estimate incidence, and you can also use the cohort study to determine prevalence. The researcher selects, measures, and records data. So the researcher selects elements with respect to their exposure or non-exposure status, and also then measures and records data. So those are advantages. And also it has a low, the bias is lower compared, for instance, to a case control. So lower potential for bias than a case control study. Because here we don't have a recall, we don't have, people don't have to record things. So because people don't have to record things, because this is prospective, we are seeing things the way they are unfolding, it gives us a high chance to control for potential confounders well. Results are also considered more conclusive if you compare the results obtained from the case control study or those obtained from an observational study. Results that are obtained from the cohort study, are more conclusive. If you want to look at in terms of validity, you find that the results from a cohort study, cohort study gives us a higher validity index compared to the cross-sectional study and the case control study. But of course, the experimental study will give us a better study because you can't establish causation under a cohort study despite its high validity index. The longer a cohort study continues, the stronger it becomes. So the cohort study, with time, as it progresses, you are monitoring observations, you are monitoring those particular exposed and non-exposed groups with respect to their outcome. The longer you do that, the stronger the findings you get. And what are the disadvantages of a cohort study? It is impractical, as I said, for rare diseases. But remember, it's practical for rare exposures. So even if the risk is high, no case may occur or result. So for rare diseases, you better use a case control study. It may not be statistically significant. So the findings that you get may not be statistically significant, but it doesn't mean that the exposure has no effect on the outcome. But you may find that when you do statistically, you may find that there is it's not statistically significant. So larger sample size are required for a cohort than compared to a case control. So you need a larger sample size. Data collected is usually very expensive. Remember that you have to do follow-ups. So when you compare this particular study design to what you get in a case control study, this particular study design, is a little more expensive compared to a case control. And then you need longer time to follow up. Imagine that with respect to temporal aspect of these studies, the cross-sectional, you go in once and come out. So the cross-sectional, with this respect of time is quite efficient. But with this one, you need longer commitment. And with longer commitment, you find that, there may be some drop-off, there may be some follow-up. So you may find that some of the study units may drop off from the study. There are other study designs that can be used. We have the time series, the hybrid, and meta-analysis. So if the time series tests if incidence of a disease changes in a population over time. So the time series, it gives you an idea to see how the incidence of the disease is changing over time. So if that is your interest to see how the incidence of a disease is changing over time, then the time series could be used. Then you also have hybrid studies where you could mix the different types of study design, and also this may lead to efficient use of resources and also to reduce, and also efficient implementation of a project. So, and then you may study more factors within a particular study. And then also you can do a meta-analysis. Meta-analysis, it combines results that have been published from different studies. You have studies that have been published from different studies, and then you make judgment from that. So what is the take-home message in this presentation? So we are saying that what type of study to choose depends on the research question or objective, the time available for a study, the resources available, whether the disease is common or rare, the type of outcome of interest, what is the outcome of interest, and so the quality of data from the various sources. And often there are multiple approaches that will work. So it's not only one approach that will work, there are different approaches that will work. So choosing an established study design gives you a huge head start in design analysis and elimination of bias. So if you choose an appropriate study design, it will really help you in terms of designing your study and also eliminating bias, and also how data will be analyzed. I want you to work on this assignment. I want you to write some brief notes on a time series study, and also to write brief notes on a hybrid study design, and also brief notes on meta-analysis, and also on systematic reviews and ecological studies. So the total number of pages should be not more than 5 pages. So write brief notes on this type of studies designs, and then submit within the coming few days. Okay, and this has to be not more than 5 pages. So thank you for listening, and this is the reference you can check.